My name is Eric New. Welcome to Get Healthy Perry. Today, I'm here with Mr. Gary Robinson, the Vice President of Lake Health, who will be discussing the partnership between the Perry Local School and Lake Health. This is the first in a series of interviews that will be part of Get Healthy Perry initiative between the school and Lake Health. So, Gary, can you tell me a little bit about the partnership between Lake Health and Perry Schools?
Well, I appreciate you having us, Eric. This is a great opportunity for us to talk about the partnership. The most visible part of the partnership, I think, that most people recognize is the walk-in care center that we have constructed on the campus. And that was an exciting endeavor. We basically took a storeroom, a 2,000 square foot storeroom, and a hallway, and converted it into a walk-in care center that has exam rooms, capabilities for laboratory testing, physical therapy, and the hours are very convenient, I think, for the community. We're open from 2:30 till 9 o'clock at night, and we're always looking to adjust those hours to accommodate new services that we're adding and so forth. But in terms of the partnership in general, it's not just about the walk-in care center. We have a lot of collaborative initiatives going on. For example, we have scholarships available for the kids. Kids that are wanting to go for a healthcare career and are signed up. We have 3 scholarships available, 3 $1,000 scholarships available. We also have our caregivers actually in the schools. So we have a program called Healthy Heart, and we offer that education to kids K through 12, and it talks about nutrition and diet and exercise and how that's important for not only a healthy heart but just a healthy individual. In addition, we have internships available, and we like to do programs where kids can put things on their resume. So for example, this program, I think is a good example, and we're looking forward to working with all kinds of Perry students to put the program on.
So why did Lake Health choose Perry Schools to partner with?
Well, actually, Perry chose Lake Health to participate. I think the whole vision of the program was crafted in the minds of administration here at Perry, led by Michael Sawyers and Rosemary Gornick and Lou Gallant. They had a vision of a collaboration that they wanted to do with a healthcare provider. They sent out a request for proposal to local providers, the Cleveland Clinic, Lake Health, University Hospitals. And we each came in and described how we would partner and what we thought the collaboration would look like. And in the end, we are very fortunate and happy that Perry selected us to do this partnership.
Mm-hmm. So can you describe how the community can get more involved?
Well, the overall sort of program name is Get Healthy Perry, and that's the idea. The idea is for the community to become healthier. So we do have programs such as Get Healthy Perry, where people in the community can do walking initiatives, can get involved in other programs that we have. But I think the most important is to participate in a personal health profile. We make those available at various events in the community. And why that's important is the personal health profile probably takes 5 minutes to 10 minutes to complete. We never divulge a person's results. We always look at in aggregate. So the idea is in aggregate, when we look at the personal health profile of the community, we can identify what risks are out there specific to the Perry community. And then in response to that, we can put together programs. For example, obesity is a problem that we've identified, not just in Perry, ironically, but that one is throughout Lake County and throughout the country. But when we identify that there's something like that, then we put programs together that address obesity problem. So I think what the community can do is when they're asked to fill those out, it really guides programming. And then finally, I think we just ask them to use our services. I think a lot of folks still don't recognize the facility that we do have right on this campus. People that have come and used us are delighted, I would say. We have our staff is very responsive. They have capacity to give individualized attention, and most of the folks that do come to our walk-in care center are delighted, I think, with the services. So use us, I think, is the message.
So how can students benefit from this partnership?
Again, we developed through a grant that Perry Local Schools and Lake Health jointly went after from the state. We got a $52,000 grant to do programming in the school. And one of the things that we're using that money for was to develop a personal health profile specifically for children, which is not available in the country that we're aware of. So this is a first of its kind. So when you're asked to fill that personal health profile out, we ask that you do it. Also, I mentioned earlier that we provide scholarships. 3 scholarships, $1,000 each, and we need more people to apply for those. I think the last time we offered 3, we only gave out 2 because there was only two individuals that signed up. So, the money's there, and we want to use it. We want to spend it. We want to write the check. So, please apply for those scholarships. And I think those are 2 very good ways to get involved with the program.
So now, how do you think things are going up to this point?
It's been a year. We opened officially, I think, the end of January last year, so we're a little bit more into a year of operations. Typical of any startup, it starts up slow and then it ramps up, and we've seen a ramp up. Not in all of the services at the center, but the volume has definitely been increasing, and we've been adding services, and I think that helps. In terms of the collaboration between Lake administration and Perry, it's been just a wonderful partnership. And many of the things that we put on the table that we would like to do with this collaboration a year ago, we've already added to the list. We've modified things. And we do that because we meet regularly. We meet, probably for the first 6 months, we met every 2 weeks. And since then, now that things are up and running, we meet monthly, and we go over what's going right, what's going wrong, what can we change, and it's just an honest exchange of ideas. And quite frankly, we just had a year in review of the program, and went over what was going well, what needed work, and what were some other opportunities, and I think we're really looking forward to another successful year coming up in year 2.
Well, Gary, thank you for joining us today. We look forward to learning more about the Get Healthy Perry initiative and the partnership between Perry Local Schools and Lake Health.
Well, I appreciate you having us, and thank you very much, Eric.
For Get Healthy Perry, I'm Eric New.